Hello, my name's Ian Hamilton. I work at the University of York, and just going to give you a brief update on the Drugs Summit that the government organised last week. And I'm saying the government organised it. The Westminster government had a summit one day, and prior to that, the Scottish government decided to have a drug summit as well. Bit of a shame they couldn't have arranged to have it on the same day and perhaps collaborate on this really important issue. But just to set the context, really, we have record numbers of people dying as a result of drugs in the UK, and it seems that as things stand, there's little that is going to prevent new records being set this year. So this summit's really, really important, and I guess one of the most critical things that happened at the summit was Dame Carol Black, who'd been asked by the Home Office to do a review of policy, presented the first phase of her findings. So it's a two-stage process, and she presented the findings of her first look into drug policy. And although there was nothing new in what she said, I think it was important that she did kind of gather all the evidence that we have and present that to those at the summit. And this was for senior people in government, in policy, in policing, etc., that were at this summit and meeting. So really welcome Dame Carol Black's report, and you can access that online just by Googling it. It should be there. One of the other aspects to this is thinking about really how do we actually stem the record numbers of people dying as a result of drug use. And again, just demonstrating some of the complexity with this and also some of the politics. The Scottish Government has proposed that what we should have in Glasgow is something called a drug consumption room, or sometimes referred to as a safer injecting facility. So this is usually a service that's provided by the health service or by a third sector organisation that encourages people who, let's say, are injecting heroin or using crack cocaine to come into that facility with their drugs and in a safe, clean, welcoming environment, be able to use their drugs rather than a back alley or a public toilet. And this is a really critical intervention in that what it does is it reaches out to those people who we don't see in treatment. They shy away for whatever reason and don't access routine specialist drug treatment. So these kind of facilities, they're not the only measure that Dame Carol Black reviewed, but as I say, they're a good example of how contentious this area is. So the Scottish Government was keen to support this idea of a drug consumption room in Glasgow, but even before Dame Carol Black got to her feet at this summit, Kim Malthouse, one of the government ministers, had ruled the possibility of that out. So didn't explain why, just made some flippant comment about it being a distraction. So there are other measures, but just to be clear, nothing particularly concrete came out of this summit other than, as I say, the report from Dame Carol Black. So it's a watch and see, really. We look forward to phase 2 of the report, which will focus on treatment, although there was no fixed date set for when Dame Carol Black would review that, and the rest of us have access to that information. So a number of articles have been written about this. As I say, if you want to look at Dame Carol Black's report as an original document, it's there online via the Home Office. You can access it there, and various people, including myself, have also written articles which just summarise what happened with the summit and what the position is going forward. Thanks a lot for taking the time to listen, and always grateful for any comments or thoughts that you have via my point of view online. Thanks a lot.